Welcome everyone to today's webinar, How the Right Infrastructure Can Poise Your Orthopedic Practice for Growth. On behalf of Becker's Healthcare, thank you so much for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. If at any time you do not see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. Also, to learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. With all of that, I am pleased to welcome today's speakers. First, we have Dr. Wael Barsoum, President and Chief Transformation Officer at Healthcare Outcomes Performance Company. Also, we have Dr. John Mehalik from the Orthopedic Center of Florida. And last but not least, we have Dr. Jason Sansone from the Orthopedic and Spine Centers of Wisconsin. Thank you all for being here today. We really do appreciate it. I'll now turn the floor over to Dr. Barsoum to begin today's presentation.
Thank you very much, Mariah. It's a pleasure to be with everybody. I'm Wael Barsoum, the President and Chief Transformation Officer at HOPCo, Healthcare Outcomes Performance Company. Very excited to talk about growth strategies in musculoskeletal practices. Really delighted to be with my co-orthopedic surgeons, Jason and John, today. Two very different types of practices, and talking about how each type of practice and everything in between can be successful. So first, just to give you a little bit of background on who we are at HOPCo, Healthcare Outcomes Performance Company. We're the largest fully integrated musculoskeletal practice. We are musculoskeletal physician-led. Our CEO and founder, David Jakovsky, is an orthopedic surgeon. As the president of the company, I'm an orthopedic surgeon. We both actually still actively operate. Our chief quality officer, chief growth officer, chief medical informatics officer are all orthopedic surgeons. We also have PM&R docs, pain management docs, all in leadership positions throughout the company. We have partnerships in I think about 34 or 35 states today. We work with over 1,000 musculoskeletal providers. The company has over 4,000 employees and takes risk on over $500 million of musculoskeletal spend across the country each year. So HOPCo was actually established in 2005. And until about 2019 was really very much an Arizona-focused business. It managed the Core Institute, the largest musculoskeletal practice in the southwest quadrant of the United States. 2013 added Peretta, the Peretta Center for Orthopedic Surgery in Michigan, and then Northern Arizona Orthopedics in 2018. But 2019 really started to show dramatic growth. So as most of you will know, in days of difficulty, the most successful companies grow. And that's exactly what HOPCo did throughout the pandemic. We were able to find the right partners, and over the following 3 years had exponential growth. In 2019, partnered with Southeast Orthopedic Specialists in Jacksonville, which has now grown dramatically throughout northern Florida. We then signed a partnership with Ascension in 2020 to manage the musculoskeletal service lines at all of their Florida hospitals. 2021 came to agreements with Center for Bone and Joint Surgery in Palm Beach, Tahoe Fracture in Nevada, and Physicians Regional, which is part of Community Health Services, CHS hospitals. And then 2022, again, was really a breakout year. You can see all the partnerships there, including OCF, the Orthopedic Center of Florida. You'll hear from John Mehalik later today. The Swift Institute also in Nevada. Party, which is part of the University of North Carolina. I won't go through all of these, but also Premier and Philly Hand and Shoulder in Connecticut. And then this year, IOSSM growth in Fort Myers, and Ortho Connecticut, which we just announced last week. And before the end of this year, we'll be announcing one or two more hospital and practice partnerships as we continue to move forward. So again, a lot of growth in the last 3 years. I'm sure everybody here reads Becker's. I read it every day. Becker's Hospital Review asked the 10 most pressing concerns for physicians. I suspect that none of this will surprise you. Number one, compensation or reimbursement. Number two, work-life balance. I think if you had the same question 5 or 10 years ago, number two probably would have been further down on the list. But as we're training more and more younger orthopedic surgeons, work-life balance becomes more and more important to them. And this has really become important to folks. Work-related burnout and stress, the impact of healthcare reform, the fear of a lack of autonomy or control in their practices, the quality of the healthcare that they're practicing in and delivering, the ability to find a new practice opportunity, malpractice issues. Again, 5 or 10 years ago, this was probably closer to number 1 or 2 on the list. Patient-physician relationships and the implementation of electronic medical records. So these are things that we think about as a musculoskeletal practice management company. These are things that we recognize are important to clinicians and are very important to us to make sure that we get these things right with our partners. I think traditionally, when you talk to practices around what are the practice optimization opportunities that they've had, these really haven't changed very much in the last few years. I'm going to start from the right to the left, because I think as we get more to the left, it becomes a little bit more modern and new cutting edge. But medical directorships, call coverage, and stipends, these are very historically strong ways to increase revenue for a practice. Group mergers, where you can bring practice together under a single TIN, many times with the main purpose being trying to negotiate better rates. That's not really something that we feel is going to be a great strategy to continue to grow and to increase rates. I think payers are becoming very lukewarm on this strategy, and will actually openly say, you can grow together into a single TIN, but we're not going to negotiate new rates for you under that TIN. So in our view, getting together and merging to get bigger has lots of very, very good ways to save money and to increase revenue. But the idea of doing it just to try to negotiate better rates is probably not something that we see as a very long-term strong strategy. Recruitment agreements. This is a great opportunity when you have a strong partnership with a hospital and a healthcare system. And finally, managed care networks, such as independent practice associations working with ACOs, accountable care organizations. This is really a strategy around steerage of patients, and that seems to work pretty well for practices, although the big danger here is, are the groups that are doing the steerage only looking at costs, or are they truly looking at value? For musculoskeletal practices today, they're living in a world of decreased reimbursement and increasing costs. I think after we all lived through the pandemic, we have seen the cost of our MAs, of our nurses, skyrocket. Cost of supplies going up as supply chain has become more compressed globally. So it has led to decreased margins. So many practices today are looking at private equity buyouts, health system employments, or a practice acquisition. All of these can be reasonable options. We believe that our model seems to work the very best, and I'll explain why that is here in just a moment. Our platform is really designed to help optimize a practice, regardless of the size of the practice and regardless of the reason that the practice is looking to grow. And I think one of the things that's very unique today is you're going to hear from two ends of the spectrum here. Jason Sansone, now leading a brand new practice, a group of surgeons that were all employed, that left their employed model and started a practice from scratch with HOPCo helping. And John Mehalik, who is leading a practice that has been in the Fort Myers market for decades and very successfully grown, but wants to continue to grow and be ahead of the curve. So again, really two extremes of the growth cycle, but both finding that platform optimization is really key to be successful. So when we look at this, we look at practice optimization. We also look at cost synergies. So how can we make your practice run better through operational efficiencies, through keeping your patients versus losing your patients, looking at new service line opportunities, things like vein programs, MRIs, ASCs, revenue cycle improvements, marketing, a marketing infrastructure that's proprietary, that is really data-driven, quality enhancements through our programs and new ancillary opportunities. Then looking from a cost perspective, looking at our national operating platform to get cost synergies, shared systems such as IT, training, compliance, national purchasing leverage, and then of course support functions like legal costs, business development, looking at expanding your facilities or renegotiating your rents. All of these are opportunities. So all of this comes together to really provide a practice with a turnkey solution for all of the tools that they need to really optimize their platform. So I'm just going to break this down into three main buckets, and then after that, kind of explain the how. How do we do this? So the first is looking at the optimization of patient care, standardizing order sets, standardizing clinical pathways, creating protocols, standardizing patient education. These are programs that you see the very best healthcare systems in the country. They already have this in place, right? Places like the Mayo Clinic, the Cleveland Clinic, Hospital for Special Surgeries, the biggest names in healthcare in the country already do this through their institutes. Well, we like the idea of creating a virtual institute where you don't have to be necessarily employed by the healthcare system, but you can still act and think and feel like a group that is really aligned in terms of your goals and in terms of your metrics and in terms of your outcomes. So through the standardized procedure, which by the way, every provider gets to participate in that process, we can create these virtual institutes regionally so that patients do get the very highest quality, lowest cost care. The second is leadership alignment on performance standards, really being a results-driven organization. So setting standards around productivity, access, quality, patient experience, employee and provider engagement. But one thing I want to be clear about is we don't tell practices, you have to see this many patients. You can only take this much vacation. You're only entitled to this number of support staff. The practice decides all of those things. What we'll do is we'll actually help give them some standards so that they can think about, does it make sense to hire more people? Does it make sense to continue to outsource our revenue cycle? Does it make sense to run our own call center for 3 doctors, or should we instead centralize our call center with other practices in the region? Those are the types of things that we're talking about here. And then through action items that we develop through monthly business reviews, targeted year-over-year growth, and then making sure that we're structured to support all of these deliverables so that the practices, again, have this turnkey solution to be truly best in class in every region in which they practice. And then, of course, measure your outcomes. In healthcare, interestingly enough, we've been behind the 8 ball in terms of truly measuring outcomes, musculoskeletal health especially. Right? It's amazing to me as I watch football games or baseball games or basketball games, you know, the amount of data that we have in professional sports today, where they can tell you, you know, the last 7 times when it was the bottom of the 8th and the Cleveland Guardians were down by 2 and you had a left-handed batter up, the pitcher threw a slider 82% of the time. It's amazing to me, that level of detail that we have. But in healthcare, we don't have nearly that level of detail. Well, HOPCo has aimed to really change that. So we have a very, very robust real-time reporting strategy with all of our practices so they can look at provider scorecards, clinical operations, quality and outcomes, predictive analytics and artificial intelligence to help drive some of this data. Financial performance. You get 24-hour-a-day daily flashes, real-time dashboards, weekly updates, and monthly business reviews. Why? Because we want our practices to have access to the data that allows them to optimize all of their operations and to manage their costs as efficiently as possible. So in summary, optimizing patient care, which is of course the right thing to do for our patients, aligning our leaders around performance standards and outcomes, and then finally having real-time data reporting and experts that have run healthcare systems, that have run practices, that have run, you know, global marketing companies, global supply chain companies to help to help you in your practice to do this as efficiently, as effectively as possible is really the key. So now for the how. How do we do this? Well, this will just give you an example of some of the successes. So this is here just looking at MRI volumes at one of our practices. Same number of scanners. We didn't change the number of scanners. We just standardized their workflow. And you can see here, within a year, increased their volumes with their one scanner by 25%. Looking at physical therapy volumes, same thing. Same number of providers, simply standardizing the workflow and optimizing that. In only 6 months, we were able to increase the number of captured physical therapy volumes by 30%. Looking at revenue cycle, looking at things like how quickly are we submitting our bills. So when we work with a practice on their revenue cycle, we've been able to significantly decrease the number of days between the date of service and the date of charge entry, as well as their denials percentage. That's real money that drops right to your bottom line. Looking at supply chain, 2 different practices here where between the 2 of them, we're able to reduce their percent of total spend on supply chain from 14% to 6%. Really significant opportunities to just drop dollars right to the bottom line. So how do we do this? Well, when a practice starts working with us, we actually have a very robust integration team led by our Chief Integration Officer, who is also a clinician. She's a PA that's worked in the musculoskeletal space for years. And through that integration management office, which includes human resources, revenue cycle, business applications, finance and accounting, IT, clinical operations, all reporting to that IMO, that integration management office, as well as department lane owners that have a dotted line reporting structure to our Chief Integration Officer. So this is things like physician comp modeling, quality, non-clinical operations, facilities, marketing, supply chain management. This becomes a very robust program that really integrates with your practice prior to you joining the HOPCo platform. That diligence process includes the evaluation of operational opportunities and market risks for each practice independently, looking at the financial performance, looking for opportunities within that financial performance, developing a high-level integration plan for the first year with the clinicians in that practice. This is very important. Everything that we do hand in hand with the clinicians that we're working with, determining which verticals have deficiencies and then proposing opportunities for HOPCo to help with those deficiencies, working with the market leaders to get the buy-in on the integration plan, and then determining if there are any workforce changes that may need to occur post-close. There's a timeline that occurs with this. Our work usually starts well before the 90 days before close, but during that 90 days before close, that's our phase 2 diligence, where we're really building the financial impacts to changes that we're recommending and working with the practice on. Then once the close occurs, the integration process around prioritizing all of the work that's been seen in the diligence and approval of that integration roadmap, and then the execution and the handoff to the operations teams will occur. Many, many opportunities for compensation increases or compensation repair, as we call it, whether it's through physician recruitment, revenue cycle, finance and accounting, business development. I'm not going to go through this entire list, but you can see all of these different areas. And you'll notice that fee-for-service contract improvements is on this list, but it's not necessarily the goal of the process. And I think that's an important message to get across. Our goal is to really drive for value. And when you drive for value, many times the payers will start seeing that you are the best partner for them in that market, and you're rewarded for that with better fee-for-service contracting and also with steerage of patients. So looking at optimization, whether it's in your ASC, physical therapy, your ancillaries, and then looking at your cost synergies are all things that we'll be looking at. This is, again, as part of the how. And I'm not going to go through these next couple slides in a lot of detail, but just I want to make it clear that this requires an immense amount of project management knowledge, deep knowledge of all of the details that make a practice run well, and the ability to manage those details to a very extreme level in the project management to ensure that we're staying on task and we are actually delivering what we say we're going to deliver to our practice partners. So with that, I'm going to turn things over to my friend Jason Sansone, the president of Orthopedic and Spine Centers of Wisconsin. And I think you're really going to enjoy hearing what Jason's going to talk about, because this is a rarity, a group of surgeons that are interested in leaving an employed model and really building their own musculoskeletal practice. But interestingly enough, we are getting lots of inbound calls from clinicians that want to do this, and maybe even more interestingly, from healthcare systems that have historically employed musculoskeletal providers, whether they're neurosurgical spine surgeons, orthopedic surgeons, PM&R docs, who are reaching out to us saying, we have a group of employed doctors. We actually believe that they would do better spun off in their own practice, but we would like to maintain some alignment with them. So Jason, I'll turn things over to you. Thank you for your attention.
Thank you, Will. Appreciate it, and appreciate the handoff there. Will's right. I mean, going back to the initial slide, which outlined the top 10 concerns of providers that Becker's were highlighting, we were a group of physicians who actually had a very comfortable employed position. We were in a fairly successful department. We had been busy, but things had reached a stage of essentially stasis where we felt as though we weren't able to really grow our business and grow our practices the way that we wanted to. And we saw the changing face of healthcare. Everybody talks about value-based care and what are we going to do to be dynamic in the market. And really, from our perspective, we went through a years-long due diligence process to arrive at the decision that we wanted to collectively leave employment. And really, from our perspective as well, it wasn't about compensation or reimbursement, in fact. What it was about was having operational autonomy, being able to approach the market in a fashion that was novel and in a way that we felt we could fully deliver the MSK care that we knew we were capable of doing. And so at that point, really, when we came to a decision to ultimately resign from employment, this is what the market looked like. There were two predominant HMOs and or integrated delivery networks in our region of the state. And aside from that, very few independent specialty practices. There was a couple of medical specialty practices that are independent, but absolutely no independent surgical practices. In addition, we work in an environment here in Wisconsin, which not only is 18 degrees outside today, which is substantially colder than where Will and John are, but it's one of the most expensive states in the country for healthcare, so fourth most expensive state. And we saw that as an opportunity to, in fact, enjoy the arbitrage to deliver value at a lower cost given the general marketplace around us. And so there's 11 surgeons, myself included, and we departed from the hospital as, again, a stable, very predictable hospital employment practice. We resigned en masse in September of last year. And at that point, we looked around and said, we need to find a partner, because we actually don't know what we know that we're cohesive. We know that we want to do this, but the how and the mechanics of it are really a little bit up in the air right now. And so it became very, very obvious to us as we went through our diligence process with potential partners that really, from our perspective, the only option was to partner with HOPCo. This is a company, obviously, I won't reiterate what Will said, but specifically specializing in MSK practices and really providing that turnkey solution, which is what we needed. So we partnered with them in November. And as I was saying, these are really our operational goals when we started out. Be an independent practice, achieve autonomy, and establish a regional presence. So ours were pretty simple. We weren't trying to refine revenue cycle. We weren't trying to, change margins of supply chain. We were trying to establish a supply chain. We were trying to establish a clinic, so on and so forth. So the first thing we wanted to do was even come up with a brand identity, right? And so again, getting back to this concept that HOPCo offers turnkey solutions, we went to them and said, well, the first thing is we need to come up with a name and to come up with a logo. How do you go through working through that process to ensure that you're creating collateral and a marketing presence in a community where you're nascent, So again, getting back to this concept that really HOPCo offered us a very turnkey solution. Marketing, ASC development and planning, EMR infrastructure, right? All these things, payer contracting, credentialing. It's quite obvious to me if you look over the course of our last year, and I'll go through some slides about our growth, we simply would not have been able to do what we did without HOPCo. Simply, it would have been impossible. So here's an example of a timeline of events for our practice. Q4 of 2022, we literally had 11 surgeons and a shell of an office. That's it. Within 3 months, we were seeing our first patient. We had hired a vice president of the practice, a clinical manager, 4 clinical staff. All the way up through to this quarter, we're looking at we've opened escrow on a property. We're going to build an ASC. We've hired additional surgeons and physician assistants, and we've really created truly what our goal was to create a regional group, and I'll show that in the forthcoming slides. But the amount of blocking and tackling that had to occur to get us from literally 0 to 1 was so tremendously huge that, again, we would not have been able to do this alone. Here's an example of our visits and surgery growth. I'd love to be able to put compound annual growth rates on this because they would be infinite because we started with 0. But the point is you can see obvious growth of our practice here with regard to visits as well as surgery month over month. Same slide here, productivity and growth. This is an example of work RVUs by clinic day. I suspect that we will not always be experiencing 3,600% increase in work RVUs, although that would be nice. Here's more of a slide that demonstrates quite specifically what we're talking about here. So 1 year ago, we had 1 clinic in Madison, Wisconsin. Now, a year later, we see patients at 6 clinics, and we have partnerships and or do surgery at 9 hospitals throughout the region. And really, again, each of these were individually negotiated contracts and various mechanics behind them about whether it's a PSA or a direct lease agreement or so on and so forth. That's all in the weeds. But the point being, we really were able to bring our services to the entire region of the state in fairly short order in just a year. So we're pretty pleased with that. Similar example here, revenue generation through professional service agreements with various area hospitals. You can see a doubling since May of this year. Prior to May, obviously that number was 0. And so really at the end of the day, the message here is that we were able to accomplish all of these goals that we set out for, which again, from our perspective as a nascent group, we're fairly straightforward, right? Open independent practice and become autonomous. Really, HOPCo has very much allowed us and facilitated us accomplishing these goals. And I think one of the other points that Will touched on, but it bears mentioning here, is it allows you to engage with other systems and other players in the healthcare ecosystem in ways that you would have never been able to do either as an employed physician or as an independent physician without having representation from a company such as HOPCo to do that. So thank you for your attention. I appreciate it, and more than happy to answer any questions toward the end of the presentation. But I'll turn it over to Dr. Mehalik now, who obviously comes at you from a very different perspective, having had a successful and well-established group in Florida.
Thank you, Jason. Thank you, Will, as well. As Jason and Will both said, we came at this from a little bit of a different angle here in Southwest Florida. I'm going to kind of walk you through where we started, where we are today, and what our vision is going forward. So I moved to Southwest Florida 21 years ago and joined a group that was relatively successful. At the time, I joined as the 3rd member of the group in town. At that time, there were 5 independent groups, all practicing relatively smallish in nature. The group I joined in early 2022, at that time had about 35 years of market leading experience in musculoskeletal care. There were 9 physicians and 6 mid-levels working for the group. And we had a long history and a good reputation for providing patient-centric and high-quality care but we really reached a stage where it was really grow or grow stale. So we started looking for practice partners. We started looking for merger and acquisition opportunities. We started looking at recruiting opportunities, kind of looking down all the pathways for how could we build an infrastructure to grow what we knew was a good model. That was a patient-centric, high-quality model that really wanted to concentrate on value-based care and providing the best possible patient-reported outcomes, but at the same time doing it in a way that was scalable. And what we found in our first 35 years was that in the early years, it was relatively easy to scale to a certain point, but beyond a certain point, it just became challenging both economically and from an infrastructure standpoint. So we were at a stage in our own building where we were competing with hospital systems for recruiting. Obviously, Jason's old job, a lot of those jobs are challenging to compete against based on hospital guaranteed contracts and loan repayment for new graduates. And so competing against them and not having the opportunity to provide similar level early salaries was a bit of a challenge. And then in addition, investing in facilities management and the other things that would lead us to grow also were found to be a challenge. We had sold our PT and MRI centers about 8 years earlier due to lack of profitability of those centers. We were really interested in kind of leading the market here locally and transforming delivery of care. So in early 2022, we signed our letter of intent to begin our strategic plan. HOPCo's vision for Southwest Florida, they landed in Northeast Florida first in Jacksonville. We're really interested in developing a network throughout Florida, as evidenced by a number of hospital partnerships that they began even in our area before we were part of HOPCo. So they had grown in the northeast corner of Florida in a very rapid way. We were intrigued by that. We actually were talking to HOPCo during that period of time as well. But we needed to have a better strategy and infrastructure locally to be able to get the most out of the synergies that we were going to enjoy with HOPCo. So in 2022, HOPCo had signed a hospital service line agreement with a local hospital system here. They had also signed some hospital service agreements across the remainder of Florida, and they had established a bundles-based program for value-based care with Florida Blue. And their future plan for the region was to continue to expand that network both in Northeast, Southeast, and also in Southwest Florida. And we felt like the synergies that could be had between the two companies were perfect for this region. So we really entertained all these things that Will mentioned in his slides, like how do we get to a place where we can become true partners together and take our local knowledge and our historical reputation and create something scalable that we could all grow together. And kind of like Jason said, we entertained other opportunities besides HOPCo as well, but the HOPCo model just offered an opportunity for true partnership. The idea of building something together where we still had our clinical autonomy to practice in the way that we wanted to practice, but also having all the analytics and the data-driven opportunities and the market analytics and also all of the business analytics to get us to that next level and see where the opportunities lie within our marketplace and beyond. So this idea of payer contracting, I do think needs to be stressed again. Will brought it up as a potential source for where orthopedic surgeons are always looking for where we might be able to see a little bit more on the bottom line. Payer contracting has been a focus for us in our first year of partnership with HOPCo, but as Will said, it's been a sort of a minor contributor to what we've been able to achieve in the first year. Not that we haven't been able to see a lift in what we're doing with our payer contracting, but the other things that we're working on are so much of a bigger impact to the bottom line than the payer contracting piece that I think it's important to note. So We looked at opportunity for ancillary growth in both PT and MRI. We talked about how we might be able to have strategic partnerships with other orthopedic and musculoskeletal groups in the region to grow our ancillaries. We talked about how are we going to recruit new physicians and advanced practice providers to continue to grow our network of offering, and what will we do in the local region. So, we can really, HOPCo has such a vast array of data available to be able to really analyze a marketplace and a geographic region to understand where patients are, where they're seeking their care, where the ripe opportunities are to grow your practice, where patients are happy, where they're not happy. So we talked about our geographic expansion plan. We talked about other quality programs, and then of course the value-based care network that we're in with Blue Cross. So in September of 2022, for those of you that follow this stuff, in September 29th, we had Hurricane Ian here in Southwest Florida, which was devastating to the entire region. So you'll see some of that as it comes up in my slides. But we closed literally right in alignment with Hurricane Ian, our practice partnership with HOPCo. Immediately, we began working on PT and MRI plans. We did get immediate access to their new hospital partnership agreement with Physicians Regional. We planned together to open a de novo clinic in an adjacent county in Collier County, Naples, within the first 90 days. We were able to join the Blue Clinically Integrated Network. As part of our initiative, we hired 5 new physicians and 2 new mid-levels and asked HOPCo to work with us to develop a strategic plan to recover and grow after the hurricane. We also immediately after the hurricane undertook a 20,000 square foot remodeling project in our main building, and after the new year opened the 5,000 square foot new facility in Naples. Immediately after close, we began working on the strategic plan together, and I think it does bear noting that this is a true practice partnership. We sit down once every 2 weeks and work on strategic planning initiatives, work on market analytics, try to understand where we are as a group and what the market is demanding happen and where the opportunities lie. And monthly, we work on each of those strategic initiatives. In January, we completed our remodeling and began our marketing campaign. And this slide is really good evidence to show you what happened with our growth in the first year after partnering with HOPCo, even during a hurricane recovery, which is pretty remarkable. So many of our staff and certainly many of our patients that normally would snowbird here in Southwest Florida didn't come last year because of no opportunity for anywhere to stay. There were thousands and thousands of devastated residences, so lots of hotels, condos, and houses were not available to stay in. And yet, in that year, we still grew. We grew 21% in new patient growth in our Fort Myers clinic, and we started our Naples clinic and grew that as well. So in March of 2023, we began looking at a bunch of the additional data analytics. We began to analyze supply chain. We began our compliance and internal auditing program. We began an online scheduling system. We turned over revenue cycle management to HOPCo and began optimizing that as well. By this past summer, we now grew to 23 providers. We finalized our PT hiring and opened our MRI center. We then had 2 fully functional and efficient clinics that were relatively full, and we started to revisit our long-term strategic plan just 1 year after starting our partnership. So in August of this year, we hired new physicians for our Naples location. We're analyzing a number of opportunities for additional practice partnerships. And in September this year, closed our first practice partnership with Institute for Orthopedic Surgery and Sports Medicine, another group that has been in the marketplace for over 30 years that was looking for a similar platform to ours. The advantage of us working with this group was that they had a very similar practice culture and very similar corporate culture to ours. They also had 2 additional locations and increased our practice offering to 38 total providers. We have a shared vision for where we'd like to take our local orthopedic care, and we're going to now begin working on consolidation of infrastructure and staffing, leverage with payers, and begin working on our hospital relationships as well. So this has been our ancillary growth since opening our PT and MRI centers earlier this year, and we've been able to see a very substantial increase. So one of the things that comes up in these discussions frequently is, well, how do you take 2 independent groups and sort of form a similar culture and begin integrating those 2 things together? Again, this is a little different than what Jason and his team were doing, where we're trying to bring together sort of 2 different visions, theoretically 2 previous competitors, and to work together and develop a single unified brand and culture. And I think the important thing in thinking through how this is done is making sure you find the right partner and having the right, for lack of a better word, mediator in the room, the voice of reason, the person with the data and the analytics to back up what you're trying to do together. So instead of it just being a culture battle, more about the idea of what we can do together, where 1 + 1 can equal 3 instead of just a simple merger or under one tax ID. So we're working now on developing our short and mid-range strategic plan. We're consolidating resources. We're beginning to work on our recruitment plan, and we're growing our service lines as well as improving our patient access. So that's what we've been able to achieve in the first year. We grew more than double in the first year. We grew from 1 location to 4. We expanded our main clinic by nearly double. We opened a PT and MRI center. We've seen 42% growth in new patient acquisition year over year. And we've seen a massive increase in our website traffic as well. And really, a lot of this we owe to the idea of what we get from our partnership with HOPCo, which is you in a group our size where we have only 15 providers, the idea of hiring the C-suite expertise that exists at HOPCo is just an untenable task. The idea of hiring people with that level of experience in so many different areas that have had the type of quality and efficiency training that their folks have had would be very challenging to hire. So they have a proven analytics platform. They have expertise throughout the organization to help with these types of partnerships. And of course, they have a wealth of clinical and operational resources to get it done. So that's our first year story. I'm excited to tell it. It's been a great story so far, and I'm happy to answer any questions at the end of the talk. So Mariah, thank you.
Yes, of course. Thank you all for speaking. As stated, we will now begin the Q&A section of today's webinar. And again, if you have any questions, feel free to ask them in the chat below. So the first question we have is for you, Dr. Barsoum. From the audience, someone asks, counter to the spinning off of employed physicians from hospitals and health systems, are you seeing movement in the opposite direction where independents are going to the employed model? For example, Hospital A decides to hire orthopedic physicians to perform bread and butter total joint cases, referred from their employed PCPs keeping 100% of revenue in-house?
Yeah, there's no question that model is still very, very strong across the country. The challenge with that model, very candidly, is we're seeing more and more of the bread and butter orthopedics moving out to surgery centers. So, the tricky part is if you're going to employ the docs, but you want to, and you see that the reimbursement for your musculoskeletal care is going down, and there's desire from the payers to see more of it shift to the outpatient space. As a healthcare system, are you willing to invest in the outpatient space, build an ASC, for example? And if you are, and you employ the doctors, are you willing to let them invest in that ASC? That model actually is almost untenable financially for most hospitals. It's very hard to make money when you are employing the surgeon and they are partners in an ASC that you have also invested in, because you're paying all of the cost, but you're only getting part of the revenue. So unless the hospital is kind of sticking with old time thinking, which is we're going to keep everything in the hospital, it really doesn't make a ton of sense for them to be employing musculoskeletal providers today. It's not to say that it's not happening. It's definitely happening. But you have to be really thoughtful about that model if you're going to employ your providers.
Wonderful. Thank you so much for answering that, Doctor. And the next one that I have is for Dr. Sansone. So the question from the audience is, are there any factors of being a hospital-employed physician that you now miss as being part of an independent practice?
Sure. The one thing that I miss, I would say there is one thing, which is it was predictably predictable. I knew what I was getting every day. I knew what my paycheck would be every day. That being said, when you've done that for in my case, over a decade, and developed a practice and been in a leadership position, so on and so forth, you begin to ask the question of what do I really want to accomplish professionally? And this is not taking anything away from folks who say, you know what, I want my job to be predictable. I want it to be, not a whole lot of novelty, not a lot of opportunity for growth. And that's completely fine. That's a personal decision. But in my case, and I think I speak for our entire group, if you look at what drives professional fulfillment and happiness, it's really not compensation and or predictability. It's this whole idea of autonomy. It's this idea of mastery. It's this idea of having a purpose. And what I didn't get as an employed physician were those three things. And so I wouldn't trade it for the world. Every day is now novel. It's dynamic. It's rewarding. And so, yeah, there's definitely a trade-off that one has to accept if you go from the employed model into your own independent practice.
Yeah, totally. Thank you so much for that response. Going to the next question I have, Dr. Mehalik, what made you choose HOPCo as opposed to a private equity transaction?
So for us, we were really focused on the idea of having a true partnership with somebody who had experience specifically in musculoskeletal care. So the HOPCo model was extremely appealing to us, as opposed to a traditional private equity model that might try to squeeze more efficiency out of the practice from a business modeling standpoint, but might not understand all the clinical knowledge that needs to go into making that happen. So I think for us, number one, the level of investment that HOPCo was willing to make in our practice and the commitment that they had to expanding and growing in the region and becoming a true practice partner to grow something special together was dramatically more appealing to us than a paycheck and a new boss. So the idea of the autonomy and working together to solve problems for professional satisfaction, as Dr. Sansone pointed out, building something special and different is different than just getting a paycheck. And for us, that was super important. We've got 35 years in the region providing good care already. Certainly our older surgeons might have liked the idea of just take a big paycheck and sail off into the sunset. But to create a continuum and really build something special and durable and scalable, to us, the only partner was HOPCo in that regard.
Wonderful. Thank you so much for giving us that response. If I could go back to you, Dr. Barsoum, for just a second. The next question we got from the audience is, I see escalation in volume, which is great for the practices and not so great for employers paying the bills. What are you doing for self-insured employers, direct contracting for covered lives?
Yeah, so that's a great question. So a couple things. First of all, we know in healthcare that when you improve quality, you decrease cost. What do I mean by that? if you do a hip replacement on a patient and that patient does not get infected, does not dislocate, does not go back to the ER, right? Your overall costs are going to be lower. Without a doubt, we've seen some escalation in cost over the last 2 years, probably because of some pent-up demand from the pandemic. We expect that that's going to probably plateau here relatively soon. But so the first thing I would say is managing our quality is the most important thing to us. And then second, as we work with self-employed organizations, in fact, one of the arms of HOPCo is we'll work with insurers where we will take risk for the cost of musculoskeletal care. When we do that, we build clinically integrated networks of providers that are using HOPCo supported protocols for when should you operate on somebody, when should you get an MRI. And what we show very consistently is that we can reduce the cost of care usually by over 10% in the first year. And at the same time, this is incredibly important, we can improve the patient experience very dramatically. So the cost of care is less, the quality of care is better, and the patient experience is better. So that is really, I think, the true north of value-based care in healthcare. So we're very good at doing that, but it clearly takes a real infrastructure and real effort. The challenging thing in musculoskeletal care today is that we still have across the country too much care that is provided as an art as opposed to as a science. Our desire is to drive more musculoskeletal care that is scientifically and data-driven, as opposed to, doctors saying, well, in my experience, this is how I like to do things. You're much better off doing what the data supports and what the protocols support.
Got it. Thank you so much for that. I'm sorry, go ahead.
If I can just piggyback on something you said, interestingly, I agree with everything Will said. Interestingly, we have a lot of inbound traffic and interest from self-insured employers, certainly in our region. And I guess it depends on the specific market you're talking about. But a lot of these employers have a choice between being fully insured versus self-insured. And staring down the barrel of fully insured cost with year-over-year increases 25, 30% is untenable for these places. And I think we touched on it earlier. The real path towards driving value to these self-insured employers is making sure that the transition from inpatient to outpatient is one that's successful in your market, and that you have, as Will was alluding to, really quality evidence-based driven care being provided. And so I think what you're seeing is the increase in volume isn't a sudden increase in demand for services. We're not trying to create demand where there was none previously. It's trying to drive patients into systems, into practices that really are focused on doing high quality, low cost care.
Yeah, great insight. Oh, I'm sorry, go ahead.
Can I piggyback on again, just really quick, because I do think it's an important question. Since I showed the data on the increase in the ancillary usage, all of the data I showed, fortunately, were conversion of cases that would have been done in a more expensive location for a higher contracted rate than were done in our facility more efficiently and in a less costly and higher quality way. So I think if we look at the entire value curve as it relates to musculoskeletal care, the idea of moving volume from a more expensive facility to a less expensive facility, whether that be a hospital to an ASC, or whether it be a hospital or privately owned ancillary center to a physician-owned ancillary center that can do it for less expense in a more efficient way, is the way we should be analyzing these things. So I appreciate the extra time.
Yes, definitely. Thank you all, to the three of you, for answering that question. If I could go to Dr. Barsoum and then Dr. Mehalik, all of these growth initiatives require significant investment, someone asked. Is there a period of time where the practice is less profitable? And how do you measure ROI?
Yeah, so I can start with that. So, it all depends, I think, on the type of growth you're doing. So obviously, if you're building an ASC, there's very real costs associated with that. One thing that HOPCo does do is we can actually arrange the financing for things like that. We have access to enormous amounts of capital. So, and it's at certainly significantly better rates than what a small practice might get in the market. So I think that certainly helps. But again, I mean, there are lots of ways that you can increase profitability in a practice without investing money. For example, if you have leakage of your MRIs, right? To John's point before, Dr. Mehalik's point before, if you order an MRI in a patient and they leave your practice and go have it done somewhere else that costs more, they've not done anybody any favors, right? They've gotten the same scan at a higher cost, and you haven't been able to capture that revenue. So we'll put a process in place to capture that revenue on the upside, right up front. The other thing is looking at space that you already have. Many practices already have space that is underutilized. So can we think about going through a 5S process where we look at the space that you have, and maybe we can create a space, for example, for physical therapy. Opening physical therapy isn't necessarily terribly expensive. Another example might be opening a vein clinic, for example. So all of these are ways that you can increase revenue into your practice without a tremendous upfront capital cost.
So that was our experience exactly in the investments that we made over the course of this year. With each strategic investment we made, we didn't look at it as, well, our MRI scanner is going to cost us $1 million to put in. What we looked at is the fixed cost of financing the build out and the fixed cost of leasing the scanner over time, trying to do some analysis to understand what the leakage would be, and then making sure that that investment was made in a way that mitigated financial risk. In other words, it's absolutely true that if we starved the practice of cash while we were going through some of these growth initiatives, it would be very challenging for operations. It would be very challenging for physician comp. So, as Will said, HOPCo has a wealth of connections in the loan marketplace and the leasing marketplace that allow us to leverage some of those things. But in addition, if you go to buy your house and you decide you want to put 5% down and get 3% FHA financing, that's a way better play than taking all the money out of the bank and just plopping it down on the house or putting down a 20% investment. So, we look at the strategic risk and value of investing cash versus financing those things and try to have as minimal of an impact until each one of those investments can show some upward potential. So we try to mitigate that risk early. I appreciate the question, though.
Yeah, absolutely. Thank you so much for answering that for the audience. Dr. Sansone, if I could go to you really quickly. One of the questions that came in is, how do you balance working and or partnering with a hospital that has internal orthopedics and growing partnerships in orthopedics in the same demographic area with a private practitioner?
Yeah, good question. So, interestingly, as I showed you on that map, we've done that specifically with the hospital partnerships we have. And basically what our equation for success there was to go to these hospitals and say, look, if we know you have one or two orthopedic surgeons who are currently practicing very successfully, we might add, and they do bread and butter, and then ask the question, where do you feel as though you're unable to provide services? What subspecialty do you need extra help with? What are you seeing as far as outflow from your health system or hospital, and how can we help? And so, in fact, we've been able to become what I would say indispensable parts of each of those communities due to the various either subspecialties or simply staffing or on-call issues that we can help solve for them.
Wonderful. Thank you so much for answering that question. Unfortunately, that is all the time we do have for today. So I want to thank all of our speakers, Dr. Barsoum, Dr. Mehalik, and Dr. Sansone, for an excellent presentation, and Healthcare Outcomes Performance Company for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you so much for joining us today, and we hope you have a wonderful afternoon.
Thank you, Mariah.
Thank you.
Thank you.